la I'm sure la dwe la na me we o ke video me we ro pal pingeliang de be lo ko long ke bram dong di long ko de long na me go ro be la tana la to dwe so ke ro de ke leude la mi che joy chi chieling na me de ji lo ko dwe so ke leudi eling tana na to ro de yeah so la chala la chala de pathophysiology ke pathogenesis dung DKA ke dung diabetic one of the problem ka diabetic DKA ke mi chala diabetic ketoacidosis chana je to kenyam chita chela je yeno la en diabetic ke mi chala DKA common ka type 1 diabetic la reason na joje common ka type 1 diabetic ka type 1 diabetic the low insulin production so insulin cha destroy T cell beta cell in the pancreas destroy T cell due to some reason, maybe autoimmune disease or other causes. So quick cherke na much joy hotel insulin production go take increase of blood glucose go biriam and be lab glucose ke so character iriam berora kamnial. So quick cherke no more la chikona ngai one of the reason there is no production of the insulin. Because there is no production of the insulin, there is increase of blood glucose. Because blood glucose use the tissue. Mera ude goro tissue ndang rauti goro bigangai. Lakin tissue seti minyam dia namisha adipose tissue. Adipose tissue nan la te thiol point tagatin la chol kon ka fat. Mera dia actual neke muscles. Yeah, so ken tissue nang rauto goro je bigangai ko ken they play a very important role la ke long one and jojo la ku ken glucose ku can use long term very effective glucose transporter mi jo insulin ku function very well yeah so ku kam cherke na mo dien gore je ba la take four hormone la ku involved ke tla let kelke mi insulin la ke counter regulatory hormones so ken counter regulatory hormone nyam je glucagon ku produce ke mi pancreas alpha cell mo dien Initially, epinephrine quite produce adrenal gland, inner side of adrenal gland. Merodina cortisol quite produce adrenal gland, cortex outer part. Then la hormone the growth hormone quite produce pituitary gland. So can hormone nang want to let ke insulin. La nan let ke insulin. La miche joy insulin to glucose use ke glucose nang into tissue can or monitor they will work hard ko ba new glucose ba form again so jen lan nan let ke problem la to gona la to problem tin jaman ka patient mo joje take type 1 diabetic take absolute la take miche absolute destruction of the insulin of the insulin in the pancreatic cell la gomi terium take glucose midi Goma be can or monitor big la mishale peripheral tissues tinta adipose tissue thin can muscles can energy can go so quick cherke na mo can energy to point take glucose meterarium ne one now they will try their best ko ba new glucose ba pom again so quick cherke na mo ajen go na to problem thin bi mishale be liver ba glucagon be breakdown to the energy breakdown to the glucose. Gluconeogenesis la diminution la quite define or formation of the energy from non-carbohydrate source. La miche joyo cha energy cha pom gomishi jen gonan la de pom tinka carbohydrate ke kwanta konden cham konke so ba chola gluconeogenesis. Gome chana je to kata la pom gluconeogenesis rode. Chana je to ke muscle ka muscle ke go to rode tinka muscle. La ka muscle ta kon ke protein. So be protein broad breakdown into amino acids. So kwigam cherke na mo ba amino acid ba amino acid ba jere rem ba chwan. So broad change into glucose ke process mi chala gluconeogenesis. So kwigam cherke na mo akel. Meraude en muscle take hormone chala glucagon. Glucagon bro breakdown into better breakdown but one can process your lactate so lactate better your blood stream but yen blood stream better boka liver then better your breakdown to glucose like new energy so it can go na la joje be muscle by energy by use so we did adipose tissue ta kon ke la ka adipose tissue in a normal process ka mi joje telo dia telo ta ke good insulin mi la natural insulin la take a glucose transporter and measure adipose tissue. So la way me joy glucose cha take from bloodstream by the insulin be sent into the glucose transporter, then be mutual triglyceride be breakdown ka tissue takon ke mutual triglyceride la triglyceride a formation of the glycerol mutual attach ke 3 fatty acid, so mutual triglyceride. So in normal process be triglyceride be breakdown into the energy. Yeah, so that is normal. But ka me joy ka normal process me joy telo glucose more go me takon ke enzyme mitere adipose tissue enzyme mutual lipoprotein lipase la cholje LPL. So an enzyme mo la one of the function ke mi jojo to ke normal process ka mito ke normal process la telo problem ka insulin telem la ban mi jojo take a problem ka insulin la telo insulin production again go be la bi mun chala counter regulatory hormone ba enzyme mo ba activate ken especially la hormone chala epinephrine ken cortisol ke growth hormone. So ba lipoprotein lipase ba activate ken san bi lipoprotein lipase be triglyceride be breakdown into the glycerol ken pre fatty acid. So in process mo la chalka je lipolysis la excessive breakdown of triglyceride by actually lipolysis. So I'm go mo check your contact chala glycerol ken pre fatty acid because work blood stream la go mo mendo dien be free fatty acid ba ka liver. So free fatty acid beroro dolka liver, so be liver ba kan check a long ko da ka get into glyconeogenesis. So ka pikam cherke na mo be between ba kan check be law over wilmit ko pikam cherke na mo based on free fatty acid ba kan nang ka process chala acetyl CoA ba kan nang bi wakam chala mitochondria of the liver cell. So the quick jerk and amici oka mitochondria of the liver cell be pre fatty acid ba michala ketone body ba pomake. Again go beriak ketoacidosis broader pomten. So ketone body can angdio takon get 3 ketone body minyam dena michala beta hydrobutyric acid mendo dena michala acetoacid mendo dena michala acetone. So can diokoti can kala chalga ketone bodies. So can ketone body tito they carry the proton hydrogen ion. So an hydrogen ion is more acidic. An hydrogen ion can be ketone body can release the blood stream. So go pikam cherke na go na joya hydrogen ion kwa release into the blood stream ba be can go roba blood pH can reduce ngai ko normal blood pH is from 7.4 to 7.3 to 7.4, which is more alkali. So pikam cherke na mo can goro can blood pH can a yoping. Yeah. So an hydrogen ion. So pikam cherke na ponyo goro long and go be goro be me ba ponyo goro broad maintain ko che be blood pH be maintain la charo be ger. So pikam cherke na mo be michala bicarbonate be goro ba bany into the hydrogen ion ke ba bany into the proton. So pikam cherke na mo michala carbonic acid be po. So and carbonic acid divide into the carbon dioxide and water. So then go on and be problem in your talk thing. Listen very carefully. So go quick jerga na mo go joy what you take more carbon dioxide in the blood. Be carbon dioxide be goro be ngit be activate be mishale respiratory center kama dula be goro be activate. Me joy respiratory center kama dula che activate. Respiratory center be renyo gien be mishale lung ba ko activate. So pigam cherke na mo be carbon dioxide be goro be warar ko che joy che dirayriam goro be warar la be borar point. So pigam cherke na mo jala ne ka patient me joy take mishale DKA la take mishale cosmal breathing. La year na la take mishale deep laborate sound la laborate breathing la year long la inspiratory is more higher la take mishale tidal volume la mishale tidal volume la could increase. so quick mi cher kena mo bi patient be tege mi gen reason la to mi chalmu cosmal bracing ka patient mi joje tege mi shara DKA mi do gor bi ñoo remember ka ketone body tin ci queen ye la min chal acetone ka ketone body acetone gen gas so an acetone mo be berar kel ka carbon dioxide la bi patient be tege mi chale fruity smell breathing fruity smell breathing ala patient la mi ci moy ye patient mo joja tege DKA la jege moñe limelim so ki mi cerke no mo o patient mi joja tege DKA la ko la wa acetone la werar quelque carbon dioxide yeah so this is one of the reason medo dien o ke time na joja ci porton chala hay la ci ala ci bicarbonate kan ci lo mo ko yandol so bisom proton bike jen bike goro bike wo into cell bike enter into cell so ko kwigam jerke no mo bi mi joy ci enter into cell bi mi chala potassium berar outside of the cell so ko kwigam jerke no mo bi o take more potassium in extracellular fluid la patient mi joy take DKA is also having higher risk of hyperkalemia la but take heart problem yeah so ka treatment gome because on discuss ka treatment but by la runda ka treatment la patient mi jojo take DKA la gona na jojo goro bi with aggressive treatment mi goro bi treatment bi patient bi goro bi la sukar ci ora kam mi long bi yopin la gona na ci patient ci mo ke insulin bi la mi chale la potassium level bro ñoy yopin potassium bro reduce so ki kam cerke no mo la most of the time la ko ne dum la ko confuse la gona na le di with aggressive treatment which ye goro na patient chiriam de chawon long ba goro ba mo ke more insulin ko goro be insulin be ben pin donc ci jagala blood sugar is 400 and above so goro be more aggressively la goro be blood sugar be yo pin so ki kam cherke na mo go you the blood sugar pin be potassium bro use pin into the lowest so be patient be take a normal blood sugar but indirectly the patient fall into hypokalemia which the patient la tag along the patient believe so jela gor ki je patient me joje take DKA gradually bi goro bi blood sugar bi goro bi yot pin ma tie bi yot pin ka tie mo ki insulin mi in higher dose ko goro gangi o chi patient fall into hypokalemia yeah so that is it tiri ka diagnosis criteria ka patient me joje take DKA so goro je can diagnostic criteria ti mi ci ge jeg bi ngaje no patient te polling to DKA la quite diagnostic clinically but goro can diagnostic criteria ti bi ngaj yeah many am dien patient mu take DKA la take high blood glucose la mi ci blood glucose mi ci check la jege greater than or equal to 250 milligram per deciliter yeah mi dien mi ci arterial blood gas la pH value of the blood mi ci check la jege o less than or equal to 7.3 so mi cerke no bi ngaje no patient mo ci polling to DKA mi den bi bicarbonate level la jege la normal level ka bicarbonate 22 to 28 but patient mi joy take DKA la bicarbonate level la laga less than 15 milli equilibrium per liter yeah so mi den mi chala ketone la bi ketone level especially bi urine ketone bi jega positive ke bi blood ketone bi jega positive la jege ketone greater than 5 millimole per liter so can warranty can diagnostic criteria ka patient mi joje take DKA yeah